Ladies and gentlemen, good morning. My name is Tarek Al-Tawil, and I'm one of the orthopedic surgeons at the National Institute of Neuromotor System in Cairo. My talk today will be on bilateral cemented total hip arthroplasty in a case of ankylosing spondylitis with 25 years of excellence. This is a 26-year-old man with a known case of ankylosing spondylitis, whom I have seen in 1997. And he was complaining of bilateral hip pain, have a very limited range of movement of his hips with very short step while walking. And as you can see from the AP view that the sacroiliac joints are completely fused and the spine that of the bamboo appearance. So the plan was to give him a bilateral hip replacement, one following the other, and I apologize for the quality of this X-ray. However, a standard cemented total hip arthroplasty was done on the left side first, and later on he had another one on the right side. And as you can see from the AP and lateral views, that the cementing technique that was used for the acetabular components was by making multiple small keyholes at the periphery of the acetabulum, and not the old standard technique of 3 keyholes, pubic, ischial, and iliac. This is the man sitting and standing, and this is now 10 years follow-up. And if you look at the X-rays, you would find actually that no signs of loosening or osteolysis at whether the AP or lateral views, as you are going to see. Here you are. And actually the cement mantle has an acceptable thickness as shown on the lateral views. The tips of the femoral components on left and right side. And this is the man 10 years after his surgery. He cannot get flexion more than this, whether on the right or on the left. And this is the maximum abduction that he had by the time. And this is how he takes off chair and walks. Totally independent, and he was still quite happy with the result. Now this is 16 years follow-up, and if you have a look at the X-rays, actually not much change, especially on the left side, and no signs of loosening of both components, whether left or right. And this is the man at the 16 years follow-up. Still the same way of walking, but definitely pain-free and independent. Now this is 21 years of follow-up, and actually the x-rays still show very good hip joints, and the prosthesis is still in good shape. This is a magnified view, lateral views, and this is the man standing on one leg and standing on the other. And now this is after 21 years how he is walking quite independent and pain-free. The biomechanics of these patients are altered because of a rigid kyphotic spine. This places increased demand on the hip joints. And as we mentioned before, this man has a tilted spine as a scoliotic spine, as we are going to show you later. Now, this is 25 years follow-up with this young man, and you can see the x-ray. Actually, the components are still in place with minimum affection, mainly on the right side. This is some line of loosening, but actually this is not enough to cause complete loosening of the stabular component. Is still in place. Everything is actually still in place, and you can look at the lateral views as well, and that's his spine, scoliotic, and definitely this is typical ankylosing spondylitis. And this is the man now after 25 years of bilateral cemented total hip arthroplasties, still walking freely, pain-free, and quite happy. Thank you for watching.